Hey there, health warriors! Did you know that shock isn't just about low blood pressure? It's a life-threatening emergency that can lead to organ failure and death if not treated fast? Today, we're breaking down the three major types of shock: hypovolemic, cardiogenic, and septic shock, so you can recognize the signs and respond quickly. Let's dive in. Shock happens when the body can't deliver enough oxygen and nutrients to organs, leading to tissue damage and failure. This can be caused by heart failure, known as cardiogenic shock, severe blood or fluid loss, known as hypovolemic shock, and massive infection, known as septic shock. If untreated, shock can cause multi-organ failure and death, so recognizing it early is critical. Hypovolemic shock, severe blood or fluid loss. Causes include hemorrhage from trauma or surgery, and dehydration from vomiting, diarrhea, or burns. Signs and symptoms to watch for: a weak, rapid pulse, low blood pressure, cold, clammy skin, and severe thirst and confusion. Emergency treatment: control bleeding immediately by applying direct pressure. Administer IV fluids, such as crystalloids like normal saline or lactated ringers. A blood transfusion may be necessary. Position the patient in the Trendelenburg position by elevating their legs to improve circulation. Cardiogenic shock. This is when the heart can't pump enough blood. The causes can include a severe heart attack, heart failure, or cardiac arrhythmias. The signs and symptoms to watch for are chest pain and shortness of breath, a weak pulse and cold extremities, crackles in the lungs indicative of pulmonary edema, and low urine output. Emergency treatment involves administering oxygen and monitoring vitals. Inotropic drugs like dobutamine or dopamine can be used to improve heart pumping. Diuretics are given for fluid overload, and in some cases, percutaneous coronary intervention or bypass surgery might be considered. Septic shock, a life-threatening infection. Causes include severe infections like pneumonia, urinary tract infections, and abdominal infections. Bacterial toxins can cause widespread inflammation. Signs and symptoms to watch for are fever or dangerously low temperature, flushed or pale, cold skin, rapid heart rate and low blood pressure, and altered mental status. Emergency treatment involves administering intravenous fluids, aggressively starting broad-spectrum antibiotics, immediately using vasopressors like norepinephrine to maintain blood pressure, and monitoring for multi-organ failure in the kidneys, lungs, and brain. Shock is a medical emergency that requires fast action. If you see signs of severe bleeding, heart failure, or infection leading to shock, don't wait. Call 911 immediately. Time is the difference between life and death. Have you ever encountered a case of shock in a hospital or emergency setting? Share your experience in the comments below to help spread awareness. Like this video? Give it a thumbs up and subscribe for more emergency medical tips. And remember, know the signs, act fast, save lives.